Welcome back. Well, you might think your kids have it, or they might actually be diagnosed with ADHD, but you as a parent might have it as well. Adults can have attention deficit hyperactivity disorder. And joining us this morning from Gundersen to talk about that is John Dickson, Gundersen behavioral health therapist. John, thank you for getting up with us this morning.
Good morning.
Why is this? I mean, it's kind of common. We've been talking about this a lot, but adults can get ADHD or have it as well.
Well, actually, the way we look at it is if you have it now as an adult, you always had it. The challenge is in the assessment piece. A lot of times what happens is that it's missed as children, and then when you go into adulthood, it can turn into a lot of other issues like depression, anxiety, substance use. And so what happens is it's rarely ever caught initially. So we have to actually back up and look behind that and see if someone had issues with it when they were small or a child and it wasn't assessed.
Yeah, so it's something that too can cause some other serious health problems, as you mentioned there. What should adults be looking for? Like, when should they think, hey, maybe it's time to go in and get this checked out?
I think a big part for me is, like I say, looking back to assess if you had issues with attention, focus, concentration, hyperactivity as a child. That's something of a tip-off. A lot of people are aware that they've had those concerns, but again, they're almost overridden by some of the other things that they present with.
What are some of the signs that maybe it's not just the world of multitasking that we need more and more is being asked of us, but maybe what are some of those indications that yes, it's kind of over that line and yes, we do have this disorder?
Well, what I look for is if it impairs with your ability to function consistently. This isn't something that's situational. I was having a tough day and I was overwhelmed. This is something that's persistent across the board where you're always having problems. Hyperactivity is the one that most people see. That's the one that jumps out at people. But inattention, I think, probably causes more problems because hyperactivity tends to decrease as we get older. But it's the constant issues with forgetfulness, trouble with organization, being late, time management, things like that are what you really see problems with.
Yeah, and is this something then that you should maybe bring up with your general practitioner?
Yep.
Okay.
You can do that, or if there's probably the best ways to do it with your primary care provider or with a therapist if you're seeing one for other issues. But I think it's always something good to touch base with and to just at least wonder, because so often nobody is even looking for this. They just, like I say, it'll present like depression or anxiety, and that takes center stage, and we don't look beyond it, and people get really frustrated with the treatment.
Understandably so. John Dickson, we thank you for joining us this morning talking about adult ADHD. Just 9 minutes before